Thank you, Mr. Chairman. Um, I want to start by just saying we have learned a heck of a lot about the need for a more robust public health infrastructure during this COVID time. I wanted to particularly emphasize now and focus on um, community health centers, several of which I have, many of which I have in my district, and they are a real godsend. So, Dr. Frieden, and I'm so happy to see you again. I want to thank you for all your past service and for being with us today. As you're aware, community health centers play a critical role in providing care to vulnerable populations who are predominantly lower income, people of color, and Black and Brown and Indigenous and immigrant communities across our country share a disproportionate burden of the illnesses and death caused by COVID and other diseases in the response and aftermath of the pandemic. We must prioritize um, addressing these disparities that are so chronic in our society. So here's my question. We know that COVID led to more severe consequences in the communities that I described. They have higher rates of certain chronic illnesses. What does the correlation between minority communities and a higher burden of COVID tell us about what we have to do about our public health infrastructure? Dr. Frieden.
Thank you so much, and it's nice to see you and your colleagues again, Congresswoman. I think first we have to look at the cause. Three things. One, in the disadvantaged, underrepresented communities, you see more exposure, more underlying health problems, and less access to care and vaccination. So Black and Latinx Americans are twice as likely to die from COVID and half as likely to get vaccinated. And that's not because of resistance or reluctance. That's because of a lack of access and appropriate outreach to the communities. So what do we need to do differently? We need a much stronger public health and primary care system. We need sustained investments. And when it comes to primary health care, I'm a big fan of community health centers. My first job was working for a community health center before I went to medical school. But I have to say that they need to be fully supported, but they're only going to address 10 or 15% of the population need. And therefore, we really do need to fix the way we fund health care so that we have an ongoing support for primary care. Primary care has to be central to our healthcare system. That includes community health centers, and as the bill has, Indian Health Services and others, but it also means looking at how we make sure that doctors, nurses, pharmacists, physician assistants, and others can play a critical role in quarterbacking and improving care. It's quite striking. It's not just about the minority communities. The US as a whole lives on average about 4 years less, and the time we're alive, we live with more disability than other countries in Europe and elsewhere. And that's because of weak public health and weak primary care.
That's an unacceptable number that you just gave us. I wanted to connect, though, what we're talking about to what people commonly think about infrastructure. A recent survey of health centers across the country found that capital project investment through 2025 would cost about $17.5 billion. The top areas of focus for current planning has to do with medicine, medication, mental health, and et cetera. So how do we link this to infrastructure? What are the infrastructure issues that are going to address the problems that we're facing?
So briefly, one of them is data. Data systems need to be updated and maintained over time. Another is training of staff. So we need to upgrade the number of people. A third is actual facilities for primary health care, community health centers, and others. In addition, we need to ensure that we are strengthening not just the people and not just the informatics, but also the broader systems that collect information, surveillance or monitoring systems, so we can track diseases and track the effectiveness of primary care programs, because we're not getting the kind of health value for our health dollars that we need. So we need data systems, we need information systems that are broader than data systems, and we need the people and the places to do it right.
Thank you so much. And I look forward to addressing some of these in this bill that we're discussing today. Thank you.